So finger clubbing, tell us the causes of finger clubbing.
Okay, using the mnemonic, we've got congenital alternative heart disease, lung abscess, ulcerative colitis, bronchiectasis, mm, benign, that's
Mesothelioma.
benign mesothelioma, infective endocarditis,
Yeah.
neoplasms and lung cancers,
Yeah.
and then
Don't forget idiopathic pulmonary fibrosis
idiopathic pulmonary
is under
fibrosis.
I.
Yeah,
Well done. Yeah.
and
I present to you a patient who has been coughing for a couple of weeks. He's been coughing for 2 weeks now. His diagnosis is bronchitis. He's asking you when the bronchitis is likely to resolve. What would you tell him?
the cough. Is it okay? How long is likely to resolve? It's 2 weeks, so I'm thinking it's 8 weeks.
So 8 weeks is not correct. Who knows?
3 weeks.
It's 3 weeks.
3 weeks.
Well,
yeah.
I present to you a patient. He says, Dr. Ola, this common cold, like you people call it, is not common at all. I've had it for 7 days and it's not shifting. How long will I continue to have it? What would you tell him?
It's 3
One
to
and a
5
half.
days.
10 days.
So about 10 days.
Then
Yes,
one
1.5.
and a half.
Yeah, 7 to 10 days. Some people say 10 days on average. How about a patient that has got tonsillitis? They want to know, once you've given them treatment, they want to know how long they can expect it to clear away on average.
7 days.
7 days is correct. How about otitis media?
Less than 4 days. 4 days.
Yeah, so about 3 to 7 days, which is about 4 days. Well, you are reading a question, and the question says that the resolution time is usually about 2.5 weeks. So about 14 to 17 days or 14 to 19 days. What condition is that?
Is that sinusitis?
Good. Acute rhinosinusitis. Acute rhinosinusitis.
Acute
Yes. How would you manage sinusitis?
Acute sinusitis, usually, if just to let them know that it's usually self-limiting.
Good.
We expect it to. They could get the symptoms for up to 7 days, up to 2 weeks. Sorry,
Up to 2.5 weeks.
up
Yes.
to 2. Yeah, and usually we start conservative paracetamol and ibuprofen.
Yes.
And if it's not resolving, the symptoms persist, then we need to give antibiotics.
So if symptoms persist, you need to give antibiotics. Is that the correct thing to say? Or if we see certain symptoms, we need to give antibiotics. Which one?
If it's prolonging, if there's symptoms
So the
persist
reason
for
for
7
antibiotics,
days,
is it because it's prolonged? Is that what the guideline says? Or is it because there are some other features that are now present? Which one?
because there are other features present, such
Exactly.
as
So what are those features?
persisting fever,
So the patient can have fever, yes.
if we feel that there is
What type of nasal discharge would they start to have?
green,
Yeah, so it may be
discharge.
greenish, dark brown, yellowish, whatever color to show some certain organisms. Yes, what else?
can't think of any.
Who knows what else can indicate that the patient is unwell with acute rhinosinusitis? Can they have yeah, go ahead.
I think they can also start to cough because they can start coughing and become productive.
They can have a complication like chest infection. Yes. Can they have systemic features as well?
Yeah, fever.
So they can have their pulse rate to be increased. Other things will show that this patient is getting, this patient is unwell. So those pictures will be what we'll use to give antibiotics, not because it has lasted longer than it should.
Okay.
Right. Now, a patient has chronic sinusitis. What are you going to do for them? It's been on 6 months. The patient is used to having it. They have it for months. What would you do for them?
We could recommend steroid.
What type of steroids will you be giving this patient?
Nasal corticosteroids.
Nasal. Which ones do you think will be best? Which ones do you know?
Mometasone.
Mometasone can work. Any other one?
Beclometasone might also be helpful.
Beclometasone. Any other one?
There is. I'm not sure about flutes.
Fluticasone is the specialist recommendation. In fact, there's a branded one called Avamis. Branded fluticasone Avamis made by GSK. Okay.